Hey there, thanks for joining me on Health with Samantha DPT. I'm Samantha Holland, Doctor of Physical Therapy, and today we'll be talking about another source of low back pain known as degeneration and instability. So I want to talk about a few terms that are more specific for different kinds of degeneration in your low back. This is for neck and low back actually. So I made a little chart here. The first one in the lowest grade is just a general term called spondylosis, and it's just a fancy name for degeneration. And I want to clarify that everyone is going to have degeneration as we age. It's just a matter of your symptoms and if it's affecting your daily life and function. So if you have an image of your low back and it shows that you have degenerative disc disease or degenerative joint disease, well, at a certain point, everyone's going to have that. It's just a matter, again, like I said, if it's causing you symptoms or a decrease in function. Okay, so that's spondylosis. The second step, or another, I guess, more aggressive form, is this term spondylolysis. So that's when you actually have a fracture in the vertebrae. So it's in a particular area called the pars interarticularis. Don't need to know that term, but there's different reasons why someone may have this fracture. You could just have degeneration, and that's a weaker spot in the vertebrae, and basically the body or the bulk of the vertebrae fractures away from the spinous process or the backside, and you can imagine that starts to become an issue. It could be from trauma. It actually happens a lot in young athletes from overcompression of their spine without having proper muscular stability. But anyway, it's a fracture in the spine that needs to be protected, and there's multiple ways to do that. Sometimes you need to wear a brace just so that it heals and you don't run the risk of getting a spondylolisthesis, which is the next thing we'll talk about. Otherwise, the main thing that you can do to help stabilize your low back or neck is muscular stability. So that's when deep core training comes into play. Then number 3 here is, like I said before, spondylolisthesis. So that's when you actually have a slippage of one of the vertebral bodies or the bulk of the vertebrae slipping forward. A lot of times it's because of that fracture. It's fractured right there and it just starts to slip forward due to lack of stability. Or you just have degeneration and it starts to move forward from compression of the discs or things over time, and that vertebrae starts to slip. So people will actually start to hear and feel clunking in their spine, and that's that vertebrae moving out of place. You can imagine again that this is not a good situation to be in, and you don't want a lot of shearing of the vertebrae because your spinal cord is close by. But again, core stability is huge in this situation. Sometimes it does result in surgery if it's too unstable, and you might have to have a fusion or a discectomy or things like that. But I have seen them resolved with bracing, core stability, physical therapy, getting yourself stronger, and really it's just the awareness of your posture. So in this situation, most of the time, the vertebrae is slipping forward, so going into extension or going backwards is not ideal. It's unsafe really because it could potentially cause the vertebrae to slip more forward. So we do a lot of flexion-based activities or knees to chest, things like that, to protect yourself. And then usually you have to take out certain physical activities that might be adding compression or shearing to the spine. Okay, so that's an overview of degeneration/instability of the spine. Like I said, degeneration is common, going to happen. What you don't want is severe instability. In another video, I'll talk about other forms of instability that come from ligament laxity or different physical activities you did growing up, which could lead to SI joint pain. But this sort of instability is actually in the vertebral body, called a spondylolisthesis, when the vertebrae is slipping forward. In that instance, imaging would probably be warranted so that you can find out specifically which vertebrae and how severe. If you have questions about rehabbing this, because it is possible, please let me know. Please subscribe for more educational videos like this, and stay tuned.